Hello, I'm Dr. O'Connor with UnityPoint Clinic OB. I'd like to share with you today what to expect when you come to the hospital when you are in labor and when to come to the hospital in labor. So if you think you're in labor, the first sign that would get you to the hospital, if you think that maybe you broke your bag of water and you're leaking fluid and you're unsure, you can always come directly to the hospital. You do not need to call the office or the hospital. If it's during the day between the hours of 5 a.m. to 8 p.m., you can report to the front entrance of the hospital. If it is after 8 p.m. and before 5 a.m., you have to report to the emergency room because the front entrance is locked. Another reason to come to the hospital, if you're experiencing contractions every 4 to 5 minutes, lasting a minute, and that should go from the start of one contraction to the start of the next contraction, and this should go on for 2 to 3 hours straight if this is your first baby. If you're having your second baby and you've already delivered vaginally once, you should come to the hospital after 1 hour of having contractions every 4 to 5 minutes, because the second baby can deliver a little sooner than the first baby. If you're expecting to have a repeat cesarean section and you think you're in labor, you also wanted to come to the hospital within an hour of having contractions. Braxton Hicks contractions and real contractions can be very similar, so the key is the length of the contraction. If you're having a contraction that lasts a minute long and it comes every 4 to 5 minutes and that goes on for a couple of hours, you need to be checked for actual labor. If your contractions are very irregular and they're every 4 to 10 minutes, or then they're 12 and 15 minutes apart and back to 2 minutes, then that's probably Braxton Hicks contractions. You will probably not deliver the baby until you're having contractions every 2 to 3 minutes, so you should have time to get to the hospital. If you have a scheduled induction or a scheduled C-section, the office will schedule you a COVID-19 test 3 days prior to your procedure, which will be completed through the main entrance of the hospital between 6 and 8 o'clock in the morning. And if you come into the hospital in labor, we'll do a rapid test when you arrive, which takes about 1 hour for it to be completed. So when you arrive to the hospital, if you're coming through the emergency room, you'll see someone there direct you to labor and delivery floor. If you're coming through the main entrance during the day, you can go right to the 4th floor and be checked in at the main desk. When you arrive, you'll be evaluated by one of the labor and delivery nurses to see if you're actively in labor or if it is early labor. If you're in active labor, they will call the OB doctor who is on call for further evaluation and instructions on whether you need to be admitted or if they will allow you to go back home. If you have any questions about whether or not you really should come in or not, you can always call the birth center, but you do not have to call the birth center. If you think you're in labor, we would like you just to come directly to the hospital and ask your questions when you're here.